It's time for health tips. Now here's your host, Dr. Alma Jenkins.
Good evening. Thank you so much for watching. I'm Dr. Alma Jenkins, and this is Health Tips. Before we get really started, though, let me remind you that we are more than happy to come to your church, your organization, give a talk, speak on whatever medical subject you're interested in. If you'll drop us a line at the station, they will get that message to us, and we'll be happy to come to your institution or your organization and talk about a health matter. Or if you have a specific question that you want us to address on the show, why don't you send that question in to the station, and we'll be happy to address it. Tonight, I'm going to do a couple of things. One is I'm going to talk about something that is a question that many people have, because many of you or some of you have this problem. So we're going to shed a little bit of light on this particular disease. And then second, I want to give you the ingredients to a recipe that we're going to do next time. So this time you get a chance to get everything together and then cook with me when we have our show again. So some of you will say, well, I can't just cook with you because I'm in the kitchen and I don't have television in there and la la la. So I understand. But if you are able to watch and cook, we can do it together. I thought that would be fun. So I thought I would bring the recipe and give you all the ingredients and tell you the nutritional value of this particular dish and see if we can't make it together. What do you think? All right. And then, of course, we're going to do our exercise. Because we always like to incorporate exercise into every single show. And I hope that on your spare time, or even if you don't have spare time, I hope you are making time to exercise, okay? I know you're busy. I know you feel like you don't have time, but you will regret if you are not doing exercise on a regular basis, because you're going to age quicker. You're going to walk with a little bit more of a shuffle. You're going to go slower, you know, because exercise helps to keep all of that in good working order, okay? So the disease that we're going to talk about tonight is called ulcerative colitis. How many of you have that, or you know somebody with it? So I want to talk a little bit about ulcerative colitis tonight. Ulcerative colitis. Now, some of you don't have ulcerative colitis, but you have the cousin to that, which is Crohn's disease. So let's talk a little bit about it. So first thing I'm going to do is I'm going to put a picture of a colon up here, just to give you some perspective. This is the upper GI tract here. And this is your small intestine. And it hooks up to your large intestine. Okay. Okay. So this will be your rectum. This is your left colon. This is your right colon. And this squiggly in between here is your small intestine. So I'm just going to pencil that out there. That's your small intestine. Ulcerative colitis affects mostly your large intestine, this part here. So I'm going to crosshatch the part that ulcerative colitis affects. Okay, so ulcerative colitis, so this part here is ulcerative colitis, and the squiggly is Crohn's. Okay, do we have that? All right, now, so let's talk about ulcerative colitis. You can have it in various stages. Some people just have ulcerative colitis affecting just this part of the colon. So it can affect just the rectum up to about here, or it can climb on up here, or it can affect the entire colon. Okay? Now, people that have it down here, and this is where it usually starts. Ulcerative colitis usually starts at the end of your colon and works its way up. That's ulcerative colitis. The difference between that and Crohn's usually starts in the small bowel, okay, in this squiggly part, and works its way down, okay? And ulcerative colitis starts down here and works its way up, okay? Plus, ulcerative colitis tends to be more on the surface. You know, it can form ulcers and real irritated areas on the surface and then climbs on up. So what might be some of the symptoms that you could have with it? You can bleed and you can cramp and you can have diarrhea. Okay? Bleeding, cramping, and diarrhea with ulcerative colitis. Now, sometimes you can just have it here, and we call it ulcerative proctitis or proctosigmoiditis, okay? So people that just have it here, it's a little easier to treat, because what can we do if it's just right here? You can use a suppository, or you can use an enema. How many of you have had to do that? And you know, a suppository, you just slip it right up here, and it'll go about as far as here. And if you use an enema, it'll go all the way up to here, okay? So that way you can, it's like putting a salve on an inflamed area. So it's kind of like taking sandpaper and rubbing it until you rub some of the top skin off and make it sore. That's what it looks like with ulcerative colitis, okay? So what causes it? We don't know what causes this problem. And it can extend all the way, like we said earlier, all the way through your colon. Okay? So this person has a pancolitis. That means that colitis is everywhere in the large bowel. Now, if you have ulcerative colitis and it's involving all of that, one of the things you should get checked at least once a year are your liver tests, because it can also cause problems in the area of the liver and the bile ducts and that sort of stuff. So you want to keep a little eye on that if you're somebody who's had this for a while and it involves your whole colon, okay? So it's good if you know this, because you can start inquiring when you go to the doctor. You can kind of ask about these things. Also, if you've had it through your whole colon for 20 years or more, it puts you at risk for colon cancer. So be sure you're getting your proper checkups. If you've had this for many years and it's involved your entire colon, then you need to make sure that you're getting periodic colonoscopies. Sometimes you can get polyps in these inflamed areas, and sometimes they're not real polyps. They're just scar polyps from where it's trying to heal up. So a polyp, P-O-L-Y-P, that's a growth, okay? So it's important to know if you have polyps in those areas where you're inflamed. So, you know, I wish I could hear your questions, because I know you may have some. And some of you have had this problem for some time. Some of you have it just here, others of you have it all the way to here, and then some of you have it all the way through your colon. Remember, your colon starts right here. This is where it empties into your small bowel. So it starts here and ends here, okay? So some of you have had ulcerative colitis to involve your entire colon. All right. So if that's the case, you need a little closer follow-up, okay? So I'm going to erase some of this now so I'll have room to write other things. So how do we treat it? Well, We sometimes treat it with steroids, depending on how bad things are. But now there are other medicines to treat this. We have another class of medicine that tends to help this inflammation, and they're called the mesalamines, mesalamines, mesalamines. And those are medicines like Asacol. Many of you are on that, okay? And there are others too, other medicines with different names that are in this same class. And we use that. That's like first line. And then we'll sometimes use prednisone. Now, women, I know you hate prednisone because it causes you to gain weight. So when we're on prednisone, we eat more and we gain weight. So you may not be too in favor of that. And there's a newer version of prednisone now that we sometimes use with less of a problem with side effects. Budesonide. Okay, so that's another steroid that we use. Okay, so that's a different steroid. Well, it's another steroid that we use. And then there are a group of drugs that we use IV, like some of you are on Remicade. Remicade is one of the infusion drugs. Other injection medicines include Humira and some of those drugs. So we now have different medicines that we can use, and then there are others. I'm not going to get into all of the medications because that can be individualized based on how you're doing clinically. But I want you to just have an idea of what's going on. What is going on is this area is inflamed, so it's not absorbing like it should. And when it doesn't absorb, then you get diarrhea. Now, one of the things that I think is important for you to know if you have ulcerative colitis or Crohn's is that you're more at risk for a particular infection of the gut. And who knows the name of that infection? Who knows the name of that infection? So I'm going to erase all of this now to put the name of that particular infection on here, because if you have a bout of diarrhea, you may be having a flare of your ulcerative colitis, but it may be this infection that I'm getting ready to write on the board. So ask about it. Make sure they check you for it. C. diff. You know what that stands for? That stands for a long word called Clostridium Difficile, or C. diff. That's how you can remember it. For some reason, patients with Crohn's and ulcerative colitis are more at risk for this particular bacteria. And we see it a lot at the hospital too. So, you know, you can get it, you can pass it on depending on who's handling the stool and whether they wash their hands and being very clean with bodily drainage and you know, feces and that sort of thing. But even if you haven't done that, for somehow or another, the Crohn's and ulcerative colitis patients are more at risk for C. diff. And also people who've been on antibiotics for some time are at risk for this particular problem. So I just want you to know a word about ulcerative colitis. I'm going to try to share something with you about a disease process more often because I want you to be informed. Those of you who have this problem, you need to stay on your medication. I know some of you can't afford it. Some of you were on it and then you felt better, so you stopped it, which can cause a problem as well. So you need to stay on your medication. You need to keep your appointments because this is a chronic illness. It doesn't have a cure, but it can be treated effectively. But if you don't stay on your treatment, then the disease can progress up the colon and cause you more problems. So I want to encourage you to do that. Now, we didn't talk about Crohn's disease tonight. We just talked about ulcerative colitis. At some other time, I'll say some words about Crohn's disease. And if you have questions about ulcerative colitis, I'd welcome them. Please send us a note and let us know how you're doing if you have ulcerative colitis. Tell us your story. We may even want to have you come on and talk about it, okay? So that's ulcerative colitis. Now, the second thing I want to present tonight is I want you to make a quiche. How many of you are familiar with quiche and like quiche? You can use quiche as a breakfast food. You can also make a meal out of it. You can make a quiche and a salad, say, and you've got a meal. I saw a very interesting recipe that we were using when we were talking about families and health some time ago, and it was called chicken and broccoli quiche. So I want to give you the ingredients of this quiche, and I want you to get these ingredients, and I want us to make this quiche. Now, this quiche only has 270 calories. It makes 2 quiche, 6 servings per quiche, and a serving size is 1/6 of the quiche. So if you cut it into 6 parts, 1 serving is 1 slice of that. So, you know, it doesn't take too much to get calories. So 1 slice of this is 270 calories. So even if you got 2 slices of it, you'll only have 540 calories, I guess it is. You can do the math. It's about 540 calories if you had 2 slices of this quiche, which isn't bad. If you're talking about a meal and you add what you're going to drink, if you just had that for breakfast, say, and a cup of coffee, that wouldn't be bad at all for 1 meal, okay? So just think, though, if you did 3 meals at that, you'd have 1,500 calories, which is not bad at all. And you may even lose some weight on that if you did that regularly, because many of you are eating 2,000 and 3,000 calories a day, and you're gaining, okay? So let's talk about the quiche. I'm going to write it up here, because if I write it, then that gives you time to write it as well. So first of all, this recipe has 270 calories, and it's got 16 grams of protein. 16 grams of protein, only 540 milligrams of sodium, and 2 grams of fiber. So you're getting some fiber here, okay? It's an excellent source of vitamin A, an excellent source of vitamin C, and an excellent source of calcium. So A, C, and calcium. And what is vitamin A involved in? It's involved in vision. Vitamin C is involved in, you know, just in general, you know, we think it helps guard against colds, helps with gums and the integrity of the gums. And then calcium is always wonderful. You know, we need it in our bones and that sort of thing. So what are the ingredients in this quiche? The first one is that you get 2 9-inch pie crust pans. So 2 pie crust, I'm just going to say 2 pie crusts. 4 eggs, oh my goodness. Well, just remember, this is two quiches. A cup of low-fat or skim milk. I'm just going to say milk. 1 cup milk. You can get low-fat or skim. 3/4 cups of low-fat cheddar cheese, shredded. Shredded. And that's going to be low-fat cheddar cheese. Cheddar cheese. You can just say that. Low-fat cheddar cheese. 3/4 cups of cooked chopped chicken. Okay. 10 ounces of frozen chopped broccoli. Okay. A 1/4 cup of carrots, shredded. Okay. And this is optional, a 1/4 cup of onions. Everywhere I don't put the instrument is cup, except 10 ounces of broccoli. 1/4 cup, 1/4 cup, 3/4 cup, 3/4 cup, okay? Pepper to taste. and 1/2 to 3/4 teaspoons of garlic salt. Now that's garlic salt. So that's where your salt's going to come in, okay? So those are the ingredients. You can take a minute to jot that down. You can take a minute to jot that down because I want you to have those ingredients so that you can make this with me, okay? Now when we come back next time, I'm going to give you directions as how we're going to fix this. But for right now, I want you to just jot these ingredients down, okay? So that commits us to the next show to give you directions how to make this and to go ahead and make this broccoli quiche, chicken and broccoli quiche. So you want to write up top, chicken and broccoli quiche, okay? So for some of you, this may be your very first quiche. I'm going to let it stay up for a minute. For those of you who write a little slow, you can just copy this. Okay, so I want to give you a chance to do that because I want us to make something together. You know how much fun it was to go in the kitchen and cook with your mom or cook with your dad or your aunt or your grandmother. So I think it would be fun for you and I to make this together as well. Okay, and if you really like it and you want the recipe, just drop me a line and we'll send you a copy of the recipe for this. But I can tell you that I have made quiche. And it is so delicious. It really is. And I think I made this one as well. I think I personally made this one. But it tastes delicious, I'm sure. So I want you to make this with me. And I want to know what you think about it and how it tastes for you. Okay? Now remember, you don't have to use extra salt in this dish because you're using garlic salt. That already has some salt in it. That's why you don't see a separate ingredient of salt there. Okay, very good. Now we've only got about almost 5 minutes now to do our exercise. This time has just gone by so quickly. Get your cans out. Okay, we can't go off of the show without doing some exercise. And do this for me. Invite somebody over next Saturday, mainly so they can exercise with you, you know. And I'd love to hear from you. I would love to hear what you want to hear about. There might be some disease or some problem that's just been gnawing at you, and you want to hear some more about it. Or maybe you have a problem that nobody's been able to really solve. You've been to a bunch of doctors and you know, you're not real sure what's going on. I'm not saying we can solve it, but if you send in the information to us, we can certainly give that some thought, and we can talk to other specialists dealing with that and maybe get an answer back to you. At least answer your question. We're not trying to be your other doctor even, but just to give you information, because you may not know where to get information, or there may be a question about that we can answer. We realize that we're not your doctor, but you know, maybe it's a problem that you just want a little light shed on some aspect of it that we can help you with, okay? We'd love to do that. All right, so let's get our cans and let's start with our exercise. 1, 2, 3, and 1, and 2, 3, and 4, 5. You know, a lot of times when you go to the doctor, especially if it's a very complex problem that's been going on for a while, and they're not able to tell you exactly what it is, that happens. You know, the body doesn't read textbooks. Doesn't mean you've got a bad doctor. It just means that sometimes diseases don't declare themselves fully for some time. But if we can just help answer some simple questions for you, or maybe shed some light on some aspect of it, maybe that will help you be able to understand what's going on. And maybe that will also help you to ask the questions that are going to be very beneficial for you to better understand what's going on. You know, understanding, having a grasp of what's going on means everything, okay? So we hope we can help you with that. 20, 21, I think that's probably where we were. 23, 24, 25, 26, 27, 28, 29, and 30. And 1, 2, 3, and 4, 5, and 6, 7, and 8, 9, and 10, 11, and 12, 13, and 14, 15, I'm over 16, 17, and 18, 19, and 20. A lot of times when I'm exercising, I'll put my hands way up and then my whole tummy is just bare, so it made me wonder if that was the case this time, being self-conscious, of course. All right, let's march a little bit now. 1, 2, 3, and 1, and 2. Swing those arms. 3. You know what's so funny? If my belly button did show, hey, we've all got one, right? 7, and 8, 9, and 10, 11, and 12, 13, and 14, 15, and 16, 17, and 18, 19, and 20. 2, 3, 4. Now I want you to remember that tonight what we did is we talked about ulcerative colitis. Some of you have it or you know somebody with it. We talked about how it can affect the colon and the areas that it tends to affect. We talked about the fact that people who have this are more at risk for infection with C. diff, and the symptoms include bleeding and tummy cramping and diarrhea, okay? And we talked about making a chicken and broccoli quiche, and I'm wanting you to get those ingredients. We talked about how nutritious it was. So I'm looking forward to making a chicken and broccoli quiche with you next time, and I'm looking forward to exercising with you next time. Ladies and gentlemen, thank you so much for watching. I'm Dr. Alma Jenkins. Good night.